excited to see this paper published. I've been working with the UNESCO Chair and WHO Collaborating Centre for Global Health and Education since 2019, and I totally share their vision of school as a place that can build a foundation for healthy lives, where students learn about health and in turn being healthy enables them to make their maximum educational achievement. I'm a pharmacist by background, and I have a particular interest in the lives at school of young people who have chronic illnesses like diabetes or asthma or arthritis. And a few years ago I went to some schools with a group of community pharmacists in my home region of Manchester in England, and it was fascinating to learn more about how schools worked and to have engagements with different groups of staff. So as we signed into the building, we saw the administrative staff, and they knew why we were there, and they wanted to tell us their stories of engaging with families when they call in to report days of absence and their concern about sending their children back to school too soon after they've had an asthma attack, for example. And then we would see pastoral coordinators and guidance counsellors who wanted to know about that well-being of the students in their school so that they were healthy and ready to learn. And then the teachers and head teachers wanting to know more about the condition and how they could help, especially in situations like urgent care. And then we talked to the school nurse, and they were so pleased to see us there. But you could tell that they only had a few minutes to see us. They were responsible for several schools. They were really stretched with their workload. Themes in this paper give health professionals ideas for getting more involved in the schools in their community on an ongoing basis. So not just the traditional roles of perhaps going in to give a guest presentation, to talk about one particular student, or to, advise on a particular initiative, but to think more holistically and long-term about the life of the school, being advocates when changes are planned, being interested in what school is teaching young people about healthy matters, and being there to support the staff, to build capacity in them so that they can express health messages and healthy lifestyle skills through everything from literature to physical movement into the science subjects. I hope that you will appreciate this difference in the direction of travel, and it's something that the pandemic has really brought into sharp focus, that if health and education professionals had been working together more closely when the pandemic hit, that maybe we would have had great ways to cooperate in terms of implementing infection control measures, thinking about well-being strategies for students and staff, and perhaps even access to equipment such as sanitizer. I've really appreciated being part of a multidisciplinary team, and I hope that you will read on to find out more about this work.